In Bree's case, she had a right brow that her whole entire life was higher than her left brow. And she also was starting to get an elongated forehead, like we all do as we age. Our foreheads tend to elongate, even females, males even more so. And so in order to correct that, we run our incision right at the front of the hairline. So it follows right behind the first hair or two of the hairline. It's beveled so that the hairs eventually go through and hide the line. It's not perfectly straight because we corrugate it so that it doesn't catch the eye. And it's not perfectly straight because it follows your natural hairline, which wasn't straight by its own nature.
What in the Dr. Frankenstein is going on here? But this patient is kind of an example of some of the more, I guess, radical forms of brow lifting. So you can see that in her case, the incision goes basically from ear to ear, so all the way across her forehead. In this situation, it really probably was more of a forehead reduction type of procedure where they wanted to, lower the hairline and reduce the amount of forehead, but at the same time doing a brow lift. But this is really a great example of sometimes patients fear whenever we talk about brow lift, because you can see that sometimes if you overly elevate the eyebrow, it will create this kind of surprised or shocked look. So that is, I think, this is a good example of that. And contrasting that to what we do here at ImageLift, a lot of times patients do not need this degree of brow elevation. I think that it's actually very rare that a patient would require this aggressive of a brow lift to get a good result. What I strive for is a very natural brow lifting result. The technique that I typically use is what's called a gliding lateral brow lift, where there's about 1 centimeter incision, so that's about the size of my pinky nail, right in the hairline, so it's actually within the hair. And then I'm actually coming down to work on this portion of the eyebrow. So I think we've talked about this before, but as the brow tends to come down just over time with gravity, it adds some fullness or kind of just increased heaviness to the outer corner of the eye. So releasing that brow and lifting it up really offers a nice improvement in the heaviness and fullness on this corner of the eye, but it keeps this portion of the brow, which typically is in a good position, in its natural state. So it really just gives a nice natural lift without all of the incision. In this case, her scalp is going to be numb for months. That incision that's a big incision. It's going to take a lot of time to heal. So it's just a very different approach to brow lifting than what I do here at ImageLift. So, staples in the skin, that's, I guess, kind of a professional choice. I would never do that. We always use meticulous suture closure for the best cosmetic outcome. Getting the look you want doesn't have to be complicated. We've got you.